We can thank Dr. Bahari for having an epiphany back in the 80s when he was giving 50 milligram tablets, prescribing those to his AIDS patients, who were, a lot of them were also alcoholics. And because they were not working, they would cut their medication in half, because back in the 80s, we didn't have auto bill insurance. We had to pay for everything and then submit it to our insurance on our own. So he would prescribe them 50 milligram tablets. They didn't have very much money, so they had to extend their medication. So they would break them up, and sometimes they would quarter them or cut them into eighths. And he literally realized that their T cell scores were going up, that their immune systems were getting better. I mean, HIV is it's an immune deficiency disease. So when you actually see that these T cells are going up, they're getting better, you got to go back and wonder what is going on here. And that's the difference between a 50 milligram tablet and a low dose naltrexone, is that this drug works very, very differently at typical doses than it does at low dose. That issue, that parameter of activity, is called hormesis. So when we're dealing with a hormesis drug, it means that it acts very differently, works very differently at little doses than it does at higher doses. There's not very many drugs out there that do that, but naltrexone is definitely one of them.